I had a patient who had never been to a hospital, had never seen a physician, never even been to a medical clinic. He had no exposure to healthcare. So seeing me, he was really, I was his doctor. These moments build over time this kind of feeling that you're getting closer to having someone's life in your hands.
The typical student that comes here is someone who is passionate about patient care and wanting to help. But they also have high aspirations. We love that because you can create opportunities for them to gain skills that leverage that enthusiasm and launch them off to do amazing things.
I chose UCLA because I wanted a strong research institution that had a really wide variety of clinical opportunities, both to work in the county setting as well as in a tertiary care center like Ronald Reagan Hospital.
I decided to come to UCLA basically because of its commitment to social justice. There are just an immense number of volunteer opportunities to really get yourself out there in the community and kind of gain exposure firsthand to a lot of the health disparities that many people in LA face.
The sense of community, I think, was one thing that drew me to UCLA. The faculty here, the administration, the students, they're all very dedicated to your learning experience. And everywhere that you looked, I felt there was some source of inspiration.
Our students are some of the most energetic, and they bring to that environment an enthusiasm that really does invigorate the environment.
As soon as I step foot in UCLA Med School, there's an extremely strong community. I feel like on the whole, they're just incredibly interesting people.
Over time, you develop a really good core group of friends in medical school. They've really helped me grow as a person, helped me get through medical school, but also helped me just get through life.
You'll be hard-pressed to find a more supportive environment. There's so many people that will help you get to where you want to go.
It's so easy to find a mentor too. It's so important when you're in medical school to have someone to look up to, someone who you see the way that they practice medicine, but also the way that they live their life.
I was involved in a lot of research over the past 3 years, and I really credit the UCLA staff for finding out what interested me and then connecting me to the people who'd be best able to facilitate and cultivate that interest.
For me, it was of clear importance to kind of take the summer to do a research program that also addressed issues for healthcare disparities and underrepresented communities in medicine.
They're out there, they're in Mentor's lab. The lab could be the community. The lab could be someplace here at UCLA. The lab could be a number of different places where the student is out there working in the place where work is being conducted.
We get to have our rotations through Cedars, which is a private hospital, and then Reagan, where you see the most unique patients that you probably won't see anywhere else. And then Olive View and Harbor, which give you more of the bread and butter of medicine.
Having patients that were homeless to, patients that were reading The New Yorker. It was just like, how could these two worlds be so different? And, having a role in being a medical student and medical professional in both these settings was really cool and just mind-blowingly different.
Los Angeles is an amazing city, and it was exactly what I was looking for when I was choosing for medical school.
Sometimes people say that you actually never have to leave the campus, and I think it could possibly be true. You have a variety of places to work out. There's also plays that you can come watch nearby. There's a museum directly on the campus. So really, if you didn't want to leave, you don't have to.
The new medical school building is really exciting. We have some really interesting spaces in the building. We'll have clinical skills practice areas. We'll have problem-based learning classrooms. And to the students' delight, a wonderful student lounge area on the top floor. The thing about the David Geffen School of Medicine is that we know we are the best medical school in the known universe, but we also have a hunger to try to go beyond that, to make a difference in our community, to really go beyond what traditional academic health systems have done.
I think if students are looking for an education that provides them with kind of the best of all worlds, this is the place to be.